All right, let's talk about medical aid in South Africa. It can feel like a total maze, right? Premiums just keep going up and up. So the big question is, how do you find a plan that actually looks after you without emptying your bank account? Well, that's exactly what we're going to tackle. We'll cut through all the jargon and get straight to the good stuff. I'm sure we've all been there. You get your pay slip, you see that massive chunk taken out for medical aid, and you just wince. You are definitely not on your own with that one. Honestly, the cost of private healthcare has just gone through the roof, and for a lot of us, it's become one of our biggest monthly bills. And this right here, this sums it up perfectly, doesn't it? This is from a local forum, and it just hits the nail on the head. That feeling you get with your medical savings account, your MSA. It's like, hang on, I'm just saving my own money here. And then poof, it's gone by June, and I'm back to paying cash anyway. So frustrating.
But look, it doesn't have to be that way. Seriously, what we're going to do now is break it all down, step by step. No confusing terms, just a straight-up guide to help you find a plan that actually works for you and your budget.
Okay, so let's start with the big picture. The medical aid dilemma. It's all about high costs and, well, really high stakes. So, to really get why this is such a big deal, you have to look at the numbers. Check this out. The huge majority of people in South Africa, we're talking over 85%, use the public system. So that leaves a pretty small group, just under 16% of us, who have medical aid. And for that group, picking the right plan isn't just a nice to have, it's absolutely critical for getting top-notch care when you really, really need it. Now, here's something that catches so many people out. What's the difference between a medical aid and health insurance? It's a really important one. Think of it like this. Your medical aid scheme is a non-profit. It's owned by you, the members, and its whole reason for being is to cover your medical bills. Health insurance, on the other hand, is a for-profit business. Nothing wrong with that, but it's just not designed to give you that same level of broad, regulated cover. Right, so how do we go from feeling totally overwhelmed to actually feeling in control? It all starts with you. Let's build your personal toolkit. The secret is not to try and do everything at once. Just follow these 3 simple steps. First, look at your own situation. Are you young, fit, single? Or do you have kids, maybe a chronic condition to think about? Step 2, look for easy wins to save cash. This is stuff like agreeing to use certain network hospitals or asking for generic medicines. And only then, once you know what you need and how you can save, do you actually start comparing the different schemes on things like their price and what they offer. Okay, if you remember one thing about budgeting, make it this. The golden rule is that your medical aid premium shouldn't be more than 10% of your monthly income. That's it. Use that 10% number as your anchor. It'll keep you grounded and focused on what you can actually afford. Okay, now for the big one. This is probably the most important choice you'll make, a hospital plan versus a full comprehensive plan. So, on the one side, you've got your hospital plan. This is your big disaster cover. Think car accidents, operations, the really expensive in-hospital stuff. It's cheaper, and it's fantastic if you're generally young and healthy. Then, on the other side, you have the comprehensive plans. Yeah, they cost more, but that's because they cover the day-to-day stuff too. Trips to the GP, the dentist, new glasses, all paid from that savings portion. This is usually the go-to for families or if you've got chronic conditions. Listen up, this is super important. If you're thinking a hospital plan is for you, you absolutely must know about gap cover. Why? Because specialists and anesthetists can charge like 3, 4, even 5 times what your medical aid pays out. That shortfall, that gap, is your problem. Gap cover is a cheap little insurance policy that plugs that hole, so you don't get a surprise bill for 50,000 Rand after a hospital stay. It's a non-negotiable, really. Right, that's enough theory. Let's get practical. What do some of these affordable plans actually cost? Let's take a look at the real numbers. So here are a few examples for a single person. You can see there's a pretty big difference. You've got Fed Health coming in at just over 1,000 Rand a month. Then there's Bonitas at about 1.5, and Best Med is sitting just over 2,000. Now, the big catch with these cheaper plans, and it's a fair one, is that they're almost always network plans. That just means you have to use their chosen doctors and hospitals to get the full benefit. Okay, so we've seen some prices, but remember, the cheapest option on the list isn't automatically the best one for you. Let's talk about how to make the smartest choice. So, here are a few final tips to lock in. Number 1, stick to your network providers. It makes a huge difference. Number 2, always ask for generic medicine at the pharmacy. It's the same stuff, just cheaper. Third, and this is a big one, look at your plan every single year. Your life doesn't stay the same, so why should your medical aid? And lastly, use those free checkups and screenings they offer. Prevention is always better than cure, and it's cheaper too. All right, one last thing to check, and it's a really important one: the scheme's financial health. Look for its GCR, or Global Credit Rating. Just think of it like a report card for the medical aid. It tells you if they're good with their money and if they can actually afford to pay your claims. You want to see a high score, like an AA or a AAA. That means they're solid as a rock.
And if you look at the big guys in the market, they're all doing pretty well. Discovery's got a AAA, which is top of the class. Bonitas, Best Med, and Momentum are also sitting with really strong AA ratings. What this tells you is that these schemes aren't going to disappear overnight. They've got the money in the bank to pay out when you need them to, which is exactly the peace of mind you're paying for.
So that really brings us full circle. Back to the big question: is the cheapest plan actually the best value for you? The goal here isn't just to find the lowest premium. It's about finding the smartest fit. It's that sweet spot between what you can afford right now and the peace of mind you need for whatever life throws at you.